Hello everyone. When we think of women or a woman, what comes to our mind? The different phases in her life. A little girl returning from school, running around in a playground. A young, beautiful 20-year-old just finished her college, planning to get married. Someone in her 30s, 40s, a multitasker, running a home, a family, work, you name it. And then the lady who moves on to her 40s, 50s and beyond, the peri and postmenopausal women. Each and every phase of a woman's life has different problems, shall I say. You may ask, why are you talking of problems? Not necessarily, because I think when everything goes right, we are happy. But we need to talk or think about the problems that a woman faces. A young girl today has many problems that she faces. About 30 years ago, it was only a question of going to school, studying well, getting good marks. But now, there is a lot of need, a lot of pressure on the teenager. The awareness, or shall I say, the most important impact that she feels is the sexual harassment that I would like to talk about. Teenagers today have become an idol of, lust, be it their own classmates, their own friends, their peers, even their own teachers in school and older women around them. So sexual harassment has become a major problem for teenagers. Teenage pregnancies, we may pretend it doesn't exist, but it exists in a very big way. So our focus on these young girls should be to actually try and empower them, give them the knowledge to protect themselves in all the different aspects that they need to be protected against, starting from the family, school, the place of education, and society at large. As we move on to the girl in her 20s planning to get married, what should we be focusing on? A woman who is about to get married has one major need, a preconception care, because she is entering into not just a marriage and what is going to happen immediately, but a major commitment for life. So we have to be sure that she is prepared for this major step. And ideally, it would be to see a doctor and have a consultation because, one, we would want to rule out many common problems that this girl may have. For example, is she anemic? Is she ready to undertake the marriage? What about her blood group? What about her rubella status? And while we are talking of rubella, a word of caution. We would like to have every woman have or know her rubella status before she starts a pregnancy. Because rubella today, even today, is a common cause of deafness, congenital cataract, and many other cardiac problems in children whose mothers who do not have the immunity to rubella but who are exposed to rubella infection during pregnancy. A simple test to look for antibodies and a little vaccination just before she embarks on her pregnancy will be a major contribution to society. Another common thing which we are talking about nowadays is the human papillomavirus injection or the vaccination, which again can be given before this little girl gets married, because her major exposure or her sexual debut is going to be soon, and it is ideal to protect her from the human papillomavirus infection before she gets married. Once in her 30s and maybe up to her early 40s, generally health is taken for granted. She goes about all her multiple tasks and really has no time to even think about her health. But as she enters the threshold of menopause, there are many things that she needs to think about. How is her menstrual period? Is she having heavy bleeding? Is she having anemia as a result of this? Is she aware of the various cancers that can go past her? For example, cervical cancer, breast cancer, and even carcinoma of the uterus, which is called endometrial cancer. So these are different things that she needs to be aware of, and we need to empower her about cancer screening. Apart from this, women entering the menopause also need to be aware that there are certain changes that can take place which are normal and physiological, as it were. What do we mean by physiological? These are common changes that take place in a woman, and she should be aware and not interpret them as disease. For example, at 45 plus, irregular cycles or irregular periods may not be uncommon, but she needs to see a doctor to make sure that it is normal. She may start having sudden hot flushes. She may be sitting in an air-conditioned room and suddenly break out into a sweat. Is this normal? Perhaps yes. Just before menopause, a woman can experience this. But she needs to know that it is normal. She need not run and start getting medication for this. Similarly, as her periods start getting more and more delayed and cycles between her periods increases, she needs to know that this is normal. She need not go and take medication to have a period every month. Once she crosses menopause, again, there are certain warning signs she needs to look for. If she ever has bleeding 1 year after her last period, she needs to go and see her doctor to make sure that there is no abnormal reason or growth that is responsible for this bleeding. What about her bone health after menopause? This again, she needs to have looked at it much earlier in her 40s. So she needs to know that her bone health is in good condition. She needs to know that she does not have diabetes, hypertension, some of the common medical disorders. So all put together, the different phases of a woman, the different facets of a woman's health need to be addressed. As a woman goes through her life, she comes across certain little illnesses, little symptoms, which she tends to ignore because most of the time she thinks this is normal. But to be honest, this is not really very common. Or should we say, these are not always normal. So it is up to us, not only as healthcare providers, but as women who take care of women, to empower these women and to give them the knowledge. They need to know when to see a doctor. Now, for example, a woman gets up at 5 a.m., does the entire household work, goes to work probably 9 to 5, comes back, and at about 9:30, 10, she is dead, literally exhausted. Now she thinks it's normal because she's been working the whole day. But actually, if you were to investigate her, there's a high probability that she may be anemic, that she may have a thyroid problem. And taking care of that may actually improve her quality of life. So it is very important to tell these women that they should not disregard or just throw aside what troubles them. There is absolutely no harm in trying to see a doctor or even talking to somebody about this because they may suggest some tests. Now again, in their late 30s and 40s, diabetes is very, very common in our country. And symptoms such as tiredness, loss of interest in what is going on around you, generally not being up to it, may be an indication of diabetes. So a simple blood test would tell her whether she is actually having diabetes or whether she's on the threshold of diabetes. A simple problem that can easily be corrected by taking care of her nutritional needs as well as maybe medication if required. Another common symptom that women come across is headaches. Yes, I worked the whole day, I've done so much of work, I have a headache. All I need to do is apply something on my forehead and try to get some sleep. Now, this headache may be a cause of a high blood pressure, may be a migraine that she needs to be taken care of. It even may be an indication that her eyes have not been checked, her vision has not been checked for some time. So, little things which she may think are not really bothering her, but which can be taken care of if she goes and sees a doctor. So, ideally, unless we are able to create awareness among women, they are not going to come forward to us. This is the physical aspect of her health. What about the psychological aspects? Now, before the periods, women experience what they call, or what we call, the premenstrual syndrome. Now, they suddenly feel very weepy, they want to cry, they are very, very low, they just don't want to get up and do any work or even go to work. They don't want to attend parties which normally would have excited them in a big way. They don't want to invite relatives home or entertain. This is because generally the hormonal changes that take place before a period induces these changes in women. These are again very, very common and something that easily can be taken care of. Basically telling the woman that this is normal itself is 50% of the cure. She then starts looking at these as something very normal. She experiences this, so what? I'm going to get my periods and it'll all be gone. So once we are able to give her that information, we find a major change in these women. Now, some of these premenstrual symptoms may need medical attention or even some investigation, and we can easily do these for our women. As a woman approaches her menopause, very often she feels very low. There's very low self-esteem because many women have actually put on a considerable amount of weight by that time. Overall, they're not too interested in the image. They don't take time to take care of their appearance. So all this gives them a very low self-esteem profile. At the same time, children have left home. They've either finished school and gone to college. The husband is at work. So all this contributes to what we call the emptiness syndrome, which women experience in their 40s. This again is a very, very common phenomenon, a common situation that almost every woman finds herself in, and something that can be taken care of if she only seeks help. It's all very well to say that these are the problems, these are common problems, and we need to take care of them. But how does a woman, a simple woman working at home, a woman who's busy in her office, how does she gain awareness about all these problems that we're talking about? It is very important to conduct regularly awareness programs. It could be on any media, it could be in the newspapers, it could be in the daily magazines, the weekly serials that we get, the magazines both in the vernacular as well as in English. It could be on TV programs or in between the most popular TV serials. These are times when we can actually make sure that information reaches our women. Very often, it is built into several programs, especially in the news when we watch. There are certain programs which emphasize on the need for women or women's health. So, in multiple ways, we can actually ensure that our women get all the care that they need. So, yes, it may be available, but again, we need to inform them that they have to pick up a paper and read it. They have to pick up a Tamil, say a weekly magazine and read it. Because these programs, I'm very well aware, are extremely popular and women get a lot of information from this. But it's important to give the right information and not just as a promotional activity. So all the common symptoms as we were talking about, for example, the headache or even the body pain or swelling of the legs, etc. These are commonly experienced by women. But what they often do is, one, they don't have the time to tell the husband to take them to a doctor. Even if they tell them, the husbands are too busy to take them to a doctor. And ultimately what happens? They just walk across the road to a pharmacy or any place where they can get some medicines. And over-the-counter medication is what most of them survive on, until probably the condition itself becomes really bad, and at some point they need to go into a hospital and see a doctor and go for some investigations. So this is a practice that we need to very strongly discourage. And I would urge every woman, you may think it's a trivial symptom, but please, please see a doctor, make sure that it is only trivial, and then you'll be able to enjoy your life much better. Over the past few years, all of us have been hearing about International Women's Day. Almost every woman now knows that the 8th of March is celebrated across the world as International Women's Day. Over a decade ago, there was absolutely no awareness of this. Why is this so? And I'm happy to see this because I think the general awareness and the need to focus on women's health is becoming more and more. And especially so in the last few years, the focus has been on gender bias, gender equality, and this year we are talking about break the bias. Now, when we talk of break the bias, it is break the bias at every level, right from when a little child is born. We know very well that even today, I am sorry to say this, as an obstetrician delivering babies, many a time when a girl child is born, there is a transient change in the faces of the parents, the grandparents and people around. It really pains me to see this. So, have we done enough for this world? Have we done enough for the women in this world? I don't think so. Only when everybody smiles, everybody is happy when a baby is born, irrespective of whether it is a boy or a girl, have we actually achieved something that we can talk about. So this International Women's Year, let us try and contribute our little bit to break the bias. Wishing all of you a very, very happy International Women's Day and a very happy International Women's Year to follow this. Thank you. இவ்வளோ நேரம் நீங்கள் என்ன பார்த்துட்டு இருந்தீங்க? ஒவ்வொருத்தரும் அவங்களுடைய மெடிக்கல் ப்ராப்ளம் ஏதாவது இருக்கா இல்லையா, எப்போ கடைசியாக டாக்டரை பார்த்தாங்க, எப்போ ஹெல்த் செக்கப் பார்த்தாங்கன்னு அவங்க என்ன சொன்னாங்கன்னு பார்த்தா உங்களுக்கு ஆச்சரியமாக இருக்கா? கிடையவே கிடையாதுங்க. ரொம்ப கொஞ்சம் பேர் தான் வந்து ஆக்சுவலாக ஒரு அவேர்னஸோடு அவங்க டாக்டரை பார்த்து எனக்கு எல்லாம் நல்லா இருக்கா டாக்டர், என்னோடய ஆனுவல் செக்கப்புக்கு வந்திருக்கேன் நான் அப்படின்னு சொல்கிறது ரொம்ப 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 ரேர். ஸோ என்னுடைய ஒரு மெயின் ஒரு வேண்டுகோள் உங்கள் எல்லாருக்கும், தயவுசெய்து உங்கள் ஹெல்த்தை பற்றி யோசிங்க. திங்க் அபவுட் வாட் யூ ஷுட் பி. ஏன்னா ஒரு பாசிட்டிவாக நம்ம எல்லாமே நினச்சோம்னா நமக்கு அது ஒரு எம்பவர்மெண்ட் மாதிரி. ஸோ லெட் அஸ் ஆல் கெட் டுகெதர், கோ அண்ட் மேக் ஷுவர், see a doctor, மேக் ஷுவர் தட் நம்ம ஹெல்த் வந்து நல்ல கண்டிஷனில் இருக்குது. ஹெல்த் இஸ் வெல்த் அப்படின்னு நீங்கள் எல்லாருமே கேள்விப்பட்டிருப்பீங்க. இது பல காலமாக எல்லாரும் சொல்கிறாங்க. ஆனால் நம்மளாக நம்ம வந்து அது வேண்டிய டெஸ்ட்டு, வேண்டிய மெடிக்கேஷன் தேவையாக இருந்தால் எடுத்தால் தான் நம்மளால் நல்ல ஆரோக்கியமாக இருக்க முடியும். ஸோ எல்லாரும் இந்த வருஷம் ரொம்ப ஆரோக்கியமாக இருக்கணுன்றது என்னுடைய வேண்டுகோள். தேங்க்யூ.